so they will, yeah, so they will be able to look for this information we will be provided today afterwards. So I hope you can see my slide and with my name and with the title of presentation. So yeah, those who doesn't know me, my name is Aya. I know that in Ukraine there are also some girls who have such name. And I'm representing Latvian Academy of Sport Education, and also I'm a part-time professor at the Lithuanian Sport University. And currently I'm also president of European Federation of Adapted Physical Activity. So yeah, and I will talk mainly about main aspects of autism spectrum. Also, I will talk about what is important to keep in mind when we want to assess child with autism, and not only child, but since autism is childhood disorder, which is diagnosed early in a childhood, of course, we are dealing more with children who have autism as physiotherapists, as education professionals, as social persons working in different maybe organizations or organizing some events for children. And I will present also some video examples of movement assessment for children with autism. You can afterwards also ask if you want to learn more about those assessment instruments. They are very easy to apply. They doesn't require any expensive equipment. So basically those are fundamental movement skills which can be assessed in any environment using simple equipment. Okay, talking about autism spectrum, of course, we understand that this is a spectrum of different unique characteristics of a person's behavior, from very severe end until high functioning autism, as we call, which we know as Asperger's syndrome. And in my previous experience working with children with autism, both as a physiotherapist, I've been working with children with severe autism, what we call Rett syndrome, and also severe case of functional limitations. And also I've been working with children who have Asperger syndrome, and it's very challenging. It's very interesting to work with them. And it's always challenging, especially when you plan, for example, long-term goals and how far you can see development of these children in intellectual, in sensory motor, in social development, and it might be very different from each area to another area. Yeah, so as we can see in a history, some people with autism spectrum who are very famous people, we know them today as very famous, but at that time when they were living, they were perceived as people who might be crazy, who might not belong to the average of society. And so some of those examples, for example, maybe you have heard about Charles Darwin. He had Asperger's syndrome, according previous reports, and he was quite quiet and isolated child when he was young, and he avoided interactions, and like many others people with Asperger, he sought some alternative ways, and he had very unique opinions about things around, and for example, he was certain about some topics regarding chemistry, or he was a very visual thinker, and so basically he presented some characteristics which we call today as the autism spectrum. Also, when you probably recognize Albert Einstein, and he had a number of interesting and possibly telling characteristics which indicates that he had autism, and he was kind of very isolated in his social skills, and he experienced very severe speech delays. As I read, he spoke from age of 3 only, and he had a echolalia, so which is a speech developmental disorder. And of course, he was very technical. He was very into all kind of innovations in technical things. And Bill Gates, you probably recognize, one of the richest people in the world today. And so there are questions whether he has autism and whether or not. And he falls in autism spectrum because he cites things like the distinct rocking motion Gates displays when he concentrates, and his shortened and monotone speech. So he doesn't present a lot of emotions, and he avoids also eye contact when he speaks to other people. And sometimes he doesn't speak directly to someone else, because you have heard probably that children with autism, people with autism, avoid eye contact. So sometimes he avoids eye contact when he speaks to people. And also we maybe recognize Newton, Isaac Newton. He was one of who created Newton's rules. And so he also, according to reports, had autism disorder. So yeah, it's a very interesting group of people, or especially in early childhood, when we kind of want, as a teachers, as a parent, as a physiotherapist as well, we want to assess children according particular norms, age norms. And when some children drop out of those norms, we assume and we presume that they have a disability and they are behind their age appropriate peers, which of course sometimes might be a biased decision. And we should see in a holistic way what are interests and what are other unique features of characteristics of these children presenting. So we will talk about those characteristics in a while. About 10 years ago, we still were discussing about autism spectrum disorder according different subcategories, and those categories according Diagnostic and Statistical Manual number 4 were pervasive developmental disorder, which is not otherwise specified. And I will just explain, and some of you maybe doesn't know what is pervasive developmental disorder. So Rett syndrome, and particularly Rett syndrome, is more common in girls. And I've been working with such a child who had Rett syndrome, and typically these children develop normally till age of 6 months, and then there is a delay in the future in their development. And it's very painful and very hard for parents to see how their children's skills deteriorating, and they are falling more and more behind their age appropriate peers. And it's of course related to genetical mutation, and there is no way to treat this disease. You just have to find a way how to adapt and adjust children development to the environment and potentials they have. And particularly in this family, I remember, unfortunately, the situation was that the parents divorced, and it was very a high emotional pressure on the mother to deal with a daughter who was having Rett syndrome. But this girl developed. Let's say quite well. She was more or less independent when she was grown up. I remember her, I saw her when she was 18, and I started to work with her when she was just 2 years old, when she started kindergarten. And she could walk, she could eat herself, and she could recognize some people, but she was not talking, and of course she needed the full-time assistant. So autism, childhood degenerative disorder, Asperger's syndrome. So basically in an early system of autism spectrum disorders, we had these subcategories, which are not anymore today. And I will talk about it in a minute, how this categorization of autism spectrum has changed today. So pervasive developmental disorder, which is basically which describes autism. Pervasive, it affects many different areas of the person's life, like school, relationships, social life, profession in future. Of course, it's neurological, since it affects structure in the brain. It's a developmental disorder, since it starts at a birth, but parents cannot recognize autism since birth. Like Down syndrome, you can recognize since birth, but autism is one of disease which is starting to be recognized about age of 2, maybe when children basically start to socialize and start to mature. So we know that in the autism spectrum, brain processes this information differently, what we perceive from outside, and also how persons feel inside all sensory inputs, smell, sound, light, everything which touches them, like clothes or something what they walk on, like sand or like concrete fundamental surface. So it might be challenging for these children to ask to go, for example, bare feet. So they avoid the sensory stimulus, sensory touch with hands or with their legs. So they are like my colleagues always say, if you have met one person with autism, you have met one person with autism. So when you met next person, it's another person with autism. So basically you don't find two similar or two equal characteristics in two persons with autism. In every case, every person is unique, and they have to be treated like unique persons as well. So according Diagnostic and Statistical Manual of Mental Disorders, fifth issue, which took effect in 2013, there's a slight change in description of autism spectrum disorder. Basically, we are talking about autism spectrum disorder, which indicates those as you can see, 5 basic characteristics presenting in person with autism spectrum. So persistent social communication and social interaction across multiple contexts. So basically there are deficits in social emotional reciprocity, ranging, for example, abnormal social approach. They are not communicating with people around. They very difficult or even not starting any conversations. They don't present a shared interest, for example, for children, which is typical to share toys, to share some games, equipment, and they avoid any contact with age-appropriate peers and social interactions. So restricted repetitive patterns of behavior, which for us as a physiotherapist might give indications that this child, even he or she doesn't talk yet, they present this repetitive and kind of stereotypical movements. Like my personal experience with my neighbor family in a place where I live was that the mother of 3 kids and youngest child was 9 months old. And when I talked to her, she said, oh, my youngest child doesn't want to sit. She doesn't want to even roll at 9 months. Of course, for me as a physiotherapist, it was like a signal bell ringing in my mind that something is wrong, since at 9 months we know that the child should already crawl and sit independently, more or less stable, and already verticalize. And when I saw her daughter, I put her on the floor on a mat, and she was starting do these movements, and especially when there were some audio, not even audio, but some vibration sounds, like somebody closed door, somebody open window, somebody walk on the floor. So she could feel those vibrations coming from environment. And then she started to show those stereotypical and not kind of positive, not like she would be excited, but she was afraid. And I told mother that there's something wrong and she definitely needs to consult a doctor. Even she was consulting family doctor, and family doctor didn't recognize any biases in development, which was surprising for me. And I said, okay, no, you need a second opinion. And after a while, she told me that yes, they recognize that she has autism and she is deaf. So can you imagine the child who doesn't perceive social, emotional, and any sensible signals from surrounding, and still she also is deaf, and the only signal she can perceive is something related to the vibration or kind of what she can feel from environment. And they also use cochlear implant for her, which was very challenging to teach child with autism to use cochlear implant and to perceive sounds, since she was living in a silence all early childhood. And when she was about 2 years old, she got this cochlear implant and she was tearing it off, and very challenging. But now she's 14 years old lady, young lady. She's in the school. Of course, she's in special school, special class. She can follow instructions. She can be independent. She does many things. So to be independent, so she doesn't need full-time assistance, which is very positive progress in her development. It's just one example, practical example from my personal experience, but I have so many examples, so I will not spend time much telling them, but this was very kind of early indications, which were, for me as a physiotherapist, important to notice. So yeah, symptoms must be present in the early developmental period, but may not become fully manifest until social demands exceed. So this is kind of how timely we recognize those features. And according research, those parents who indicated and noticed developmental delays in a physical domain, like in my case, this small girl at 9 months, for those parents, there were earlier diagnostic possibilities to indicate autism from a medical point of view than for those parents where children physical domain was not so kind of indicatable, but when children become 2 years old, suddenly they appeared not communicating, or they are not socially involved, and it's already kind of delayed indication for autism. Even maybe there were some earlier kind of findings presenting in a physical domain, but probably parents didn't notice, nobody told them. And when child doesn't speak, they doesn't communicate at 3 years of age, they doesn't speak, they doesn't communicate, they avoid contact. So then, of course, more signals are coming, and so of course it's important to start to find help, to look for help. But maybe if it's done earlier, so the results afterwards are much better than it's if they find out this problem later in childhood. Yeah, so regarding autism spectrum disorder, so basically what has been changed in this diagnostic manual in the 5th edition. So those 4 autistic disorder, Asperger's disorder, and pervasive developmental disorder, childhood disintegrative disorder, has been brought together So this is one of major changes which is included in autism spectrum disorder, while in persistent deficits in social communication and interactions and restrictive repetitive patterns of behavior, so social impairment, language communication impairment. So consolidation of 3 previous categories of autism symptoms have been put together to indicate the language and communication impairment. So this is kind of a small or even major change in this diagnostic manual. So social communication disorder, how it's different from autism spectrum. So maybe because more and more children get diagnosed with autism spectrum, might be possible that also diagnostic instruments becoming more precise and to distinguish between social communication disorder, which is not related to autism disorder, and where those stereotypical behaviors are not presented. So basically, just to give you this differentiation between social communication disorder and autism spectrum, so that in social communication disorder, persistent problems with the social use of language but don't have restricted interests and repetitive behaviors. So children basically don't have the same communication level, but otherwise they are keeping eye contact, they are playing together, they like to share toys and play together the same games, but they just not as verbal as other children in the group. So basically those characteristics might be related to responding to others, using gestures or taking turns. So that might be kind of affected, but otherwise there are no those physical visible features of autism spectrum. This is about diagnostics, and in international classification of disease, which will actually be effective next year from January 1st in 2022. So as you can see, the change from ICD-10 to ICD-11 is that autism and Asperger, which was indicated in ICD-10, will have one common title, autism spectrum disorder, while social communication disorder is a separate diagnosis. So probably maybe it's already in Ukraine, and maybe your medical doctors which are kind of giving diagnosis for children with intellectual disabilities, with autism spectrum disorders, they know already that. So just make sure you talk to them and understand when you have clients, patients from those groups, whether they are presenting autism spectrum or whether they are from social communication disorder group. And according statistics, 1 in 55 children around the world have autism spectrum disorder. So every 54th child. In the United States, they say it's a bit more, while there are discussions going on that maybe some children with autism get overdiagnosed because autism spectrum is becoming like normal, socially accepted diagnosis rather than intellectual disability. So, and some children might be overdiagnosed because of this specific issues. But health issues related to movement, which is very important for us as physiotherapists, understand. So these children have lower muscle tone in early childhood. Like all kids I've been working with, even this small girl, 9 months old, when she was 9 months old, she had hypotonus in her trunk, and also specifically children who have Rett syndrome, they are very hypotone, and also they have tendency to be obese. And obesity, as we know, negatively impacts motivation to participate in physical activities, in any physical exercise, because if they are delayed in movement development. So they are very challenged to get over those kind of problems in movement delay, and it's difficult to push them to persuade, okay, let's do this activity, let's play the ball, because they just avoid any contact, any kind of motivation is lost for things they don't want, they don't like to do. And that's indicated in many research that because of food selectivity, maybe they eat just one type of food, and that creates gastrointestinal disturbances, sleep problems. So also medication might create short and long-term central obesity and cardiometabolic risks. And it's very important that multidimensional effect on the individual's life perception and inclinations towards daily physical activity participation is limited. So given the pervasive nature of autism spectrum disorder characteristics in children with this disorder, so there are greater risks in general in children with autism spectrum disorder to have interfered health-related quality of life in multiple domains, in physical, in social, also in psychological. And so, yeah, just before we go next, after this overview about autism spectrum disorder as a from diagnostics point of view, so basically in autism spectrum, social skills, social cognition, language and communication skills, cognitive ability, executive functions, which is very important. And it has very high correlation association with fundamental motor skills. Actually, all of those skills have a high correlation with fundamental motor skills, because it's very very kind of related to each other. So executive functioning, which helps children to make decisions, to choose what to do and how to, for example, climb up a ladder, or how to go from point A to point B, and for example, make targeted the movement. So those skills are very closely related to fundamental motor skills, locomotions like running, walking, jumping, and playing with balls, object control skills. And also it relates with sensory processing, because we use different equipment, we use different balls, sticks, and I will show also video examples how children are very kind of it's interesting, but at the same time, it's very challenging to teach them just a simple grip of floor hockey stick, or simple movement pattern, how to catch a ball, how to throw the ball, how to dribble a ball. And it all, as we know, is very closely related to coordination, to acceptance of your own body, to understanding how your body moves. And so children have to have this experience, and especially for children with autism, it's very crucial to develop also social skills, language, communication, and cognitive skills. So what's important when we have a patient, when we have client, because I mean, we are talking about children with autism as a patient, but at the same time, we know that autism don't disappear. We can reduce symptoms. We can help child to learn how to deal with the world around, how to learn movement skills, how to learn cognitive skills, but autism doesn't disappear, and this is very challenging to understand, whether we can help children to develop according their peers, or we have to understand what is the potential and limits in a long-term goal in the future, how we select those goals to help children to be more independent in future. And yeah, so that's very important to see, and that's what we learned from our own experience when we work more and more with children with autism. So we understand, okay, so for this child, maybe communication will not be possible in the future. So we have to deal with alternative communication instruments, which are actually not so bad today, because we have laptops, we have iPads, we have phones. We can use different alternative communication technologies to help children communicate, comparing to maybe 30 or 40 years ago. So visual learning schemes, like visual stories, pictograms, which can be used. Also, what activities are important to address particular needs. For example, so the children understand stop sign. And again, example from my own experience from United States, where I was working with children with autism, not surprising, of course, in schools. And for one child, we were teaching one semester stop sign. And it was very big challenge, because this child liked to run. His favorite physical activity was running. As soon as he entered in the gym, he was running around the gym. And when we call stop, he didn't stop. He was just keep running. And can imagine situation when this child is on the street and he walks with parents, and there's car coming, and parents call stop. He doesn't stop. He just run into car. So basically, those skills we teach in physical environment, like in physical exercise, are very important when we transfer those skills to real life situation. When someone like runs away from parents and they call after him, so that this boy or this girl understands that they are kind of approached and they have to stop. And yeah, that's why I mentioned this lifetime goals and crucial goals which might impact quality of life of people in the long term. So what are visuals? What are kind of assistive visual supports we can use to help to communicate with children with autism? So there are like 4S in English. So schedules or schedules, scripts, social stories, and supports. I believe that some teachers, some presenters today later will have also similar descriptions, and maybe some content will overlap, but I will not keep much time to talk about each of those. Just give you a visual presentation, and for those who doesn't know about visual supports for children with autism, maybe it will be helpful to understand lectures which will follow me today. So yeah, we know that for these children, visual and visual presentation of sequence or what is going to be happening during a day is very important, because they are not following verbal instructions, verbal information. Not all of them, but for those who doesn't follow verbal instructions. And so regarding visual schedules and task schedules, so basically those children are very stereotypical in a way how they are behaving during the day, and they need to know what is following, when is following, and when is going to happen what. And that's why, for example, some unexpected changes in daily schedule. For example, teacher is sick, and there is substitute teacher, or something has changed in the daily schedule, and there's maybe a field trip or excursion to zoo, and these children have to know really in the detail and in advance what's going to happen, so they are not surprised by unexpected changes. And that's why to help them to accept this information, to learn their schedule, it's very important to give them information, what is to be done, how much is to be done, when it will be finished, what is next, what is coming next. For example, if you have seen movie Mercury Rising, So it's a it's a Hollywood movie. It's not like a documental movie, but it's a nice movie to watch when you have free time. With Bruce Willis in the main actor in this movie, and about a boy who uncoded the security code. Yeah, so and this boy basically has Asperger's syndrome, and an excellent movie to understand how these children behave and how strangers learn to communicate with them. And when something unexpected happens, then there are a lot of historical and like tantrum behaviors, and children are really lost when they face unexpected situations. So pictorial schedules, and for example, when we deal with physical exercises with, and basically those children in the physical domain, they can learn movements like running, jumping, object control skills, because their muscles and their joints are not affected, while of course because of intellectual challenge and perception of outside world is affected, it's difficult for them to understand like task, how and what to do. And so yeah, if a new activity is presented, so it should be presented over a minute or 2 minutes before, not like in the morning to tell what you're gonna do in physiotherapy in afternoon, but of course it should be just shortly given information shortly before activity is taking place. And so basically all those information, all that information which is given in advance will assist in reducing meltdowns due to changes in the routine, and routine is very important. And so, for example, visual schedules, it helps, and I will show you a video, short video about examples of this visual schedules and task schedules. And it helps children to understand that they have done, for example, read a story in the morning and they have a check mark. Then they did, for example, another activity where they did check mark. So basically those visual feedback also helps them to understand when you have, for example, physiotherapy, again, you have a list of activities you are doing and you are checking, okay, we did this, we did that, or child checks himself that he did it. And then he sees how much he still needs to do to finish activity. Okay, so you tell me if you don't have sound in a movie, but I think you should have sound. It will be movie in English, short movie about child who is participating in a sport camp, and he is using visual feedbacks to follow his day schedule. Kwok, can you help me to see if there will be sound on, okay?
Who did you talk to in bunk?
Yep.
My friends
And who else?
and my teachers.
Look, bud, I see Miss Aaron.
Yeah.
All right, I got your bag. Hayden is a very laid-back, cool kid. You ready to have a good day?
Yeah.
All right. I'm PJ Schaefer. I'm Hayden's dad. Hey, bud. Have a great day, all right?
All right.
I'll catch you later.
Okay.
All right. My thoughts about camp are it should be fun. I mean, we're done with the school year, and he should be able to be a kid.
Ready, bud?
Ready.
All right. My name is Erin Patterson, and I'm one of Hayden's ABA therapists. Hey, bud, you want to put your stuff away?
Okay.
And this is my second year at summer camp with him. So basically, I'm just here to help implement his behavior plan, just make sure he stays on task. Awesome.
Having a behavior plan is very important to Hayden's life. It helps motivate him, and it keeps him on track.
So this is Hayden's personalized behavior chart. We start off by making a little we, me, that is supposed to be him that he uses to move up. We put it on a piece of paper with 10 options, and these are all things that he likes to do.
You can read or have tag, or you can cook or play on the computer. Yes, pool, ice cream.
So at the beginning of the day, he starts at the bottom. meaning he has lots of opportunities during the day to work up to his most preferred item, which is his Legos. So to move to the top, what do you need to do?
You have to listen and follow instructions without any help. You can talk to your friends or your camp teachers.
These are things that he normally doesn't do on his own, but we're trying to make it more motivating for him to want to do these things.
Hey, I wonder what we're going to do in the pool.
What do you like to do in the pool?
The diving board.
You're gonna jump off the diving board?
Yeah.
Hey, I heard you ask your counselor a great question about what we're going to do at the pool. Go ahead and make yourself up. I love all this great talking this morning.
I think the most important thing of it is the child has to buy into it. The things on the chart have to be motivating to the child.
Can you go talk to one of your friends, bud?
Okay. What you do? Hey, what are you trying to do with the Rubik's cubes? It really turns a lot.
That was great talking with your friends and asking lots of questions. Go ahead and move yourself up too, because I heard 2 great comments. Camp is perfect. It's not as demanding as school, so he's a little bit more relaxed and more inclined to see what other kids are doing.
Hey, how's it going?
Good. I'm trying to figure out this Rubik's Cube.
But it's kind of hard.
Yeah, but I still can't get it to work.
Oh, I got it. Oh, I can do this.
Close, but it's really good.
There was a time when he didn't have this, and it was difficult for Hayden. Before we had the chart, he was more just discombobulated. He really likes the structure. He likes knowing what comes next. I think he also likes knowing that there are consequences if he doesn't behave.
These are things that he would lose points for. If any of these were to happen, we would take off the top one and stick it on the back. So he still has opportunities to move up and earn stuff, but it wouldn't necessarily be the most preferred item. What would happen if you...
Okay, so we stop here. Basically, I think you understand the system, and I think you maybe better understand what I was explaining before regarding pictorial schedule and visual schedules. And so I have seen a lot of such examples in schools in the United States where children arrive in the school with a list of items, and they use Velcro to move up and down. Of course, nowadays they also use iPads where they can easily move up and down all items on a daily schedule. But it helps and it motivates. As you could listen, they like structure, they like to understand what's gonna follow what, and of course they also understand what's gonna have what consequences gonna be if they don't follow their schedule, or if they do something not appropriate in the behavior. And yeah, so options always good, and this is what also helps to develop executive functioning and help to understand how to make decisions, which is very important. For example, if they have to choose between 2 meals, or they have to choose between 2 activities, what to do. So choice making is very important and challenging skill these children have to learn, and as early as possible, so they can move up and down maybe activities on your activity board, while you know that all those activities are very good for them, but they can choose, for example, order in which these activities can be done. And there is also internet links I will provide in my slides, so if you want to find out more examples, you can find in those links. And social stories, what are these one? Basically, we know that in our life we attend and we go to different places where and our day basically is filled with different situations, with different experiences. And the goal of, as you understand, of social story is to share accurate information meaningfully and safely. For example, if somebody gets lost in a shopping mall, and it might happen with children with autism, if they get lost, so they are not frustrated, they are not kind of having historical behavior, but there is particular algorithm, let's say, in their mind, what to do, what they have to follow next and how to deal with this situation. Of course, it's very exceptional situation to lose a child in a shopping mall, but still, like if for example, I'm just looking at the slide where you see this example of going to the mall, and a child knows what's going to happen in the mall, and there are many environmental kind of inputs, sensory inputs, lights, musics, sounds, a lot of people, and we have to understand that many of those children doesn't like large crowds of people. They try to avoid, and then they start to misbehave. They can fall on the floor, they can shout and scream and yell, and parents are frustrated, child is frustrated, and of course all people around doesn't know why this child is behaving like that. And it might be very, very frustrating for parents to go with a child in a social place. And yeah, that's why those social stories about particular places, particular situations in their daily life is very important. For example, social story guidelines, just to look through some of examples which are presented when creating those social stories. Even going to physiotherapist session with a child, it might be frustrating for family, and they have to explain child what's going to happen, how this situation will be, what physiotherapists will do, and what to expect, and how to deal with those feelings. So basically answer key questions are who, what, where, why, when, and how, and to present as possible accurate information, supporting, meaningful, descriptive. Basically each child, I think us even, wants to know in advance. If we go for a travel, we travel to, I don't know, like Cyprus or Brazil, and we don't know what's going to happen. Of course, it's very frustrating. We have to understand, okay, we arrive to the airport, who is going to meet us, where we're going to stay, which hotel, how our days will be filled in with a program. So it's like for everyone is very important, while for child with autism, it's even more important. So understand individual with autism and his, her attitude towards a skill, and what are concepts or situation being described. So basically quite detailed information about environment, about activities, about persons he or she gonna meet, about what kind of environmental maybe features gonna be there, maybe sounds, maybe musics, maybe some other environmental interesting things which might affect behavior of child. So let's move next. We'll show you some example. For example, make this story for 3-year-old, 4-year-old child. Of course, this might be too long. For these children, stories are shorter, but for example, about recess time in school, so which is not kind of organized and structured. And this might be very frustrating for someone to go on a recess and to see other people running around, going on slides, swinging and having fun, and nobody is really telling him or her what to do and how to behave. And it seems that other children know how to behave, but for this particular child, it's very frustrating to be in that environment. And that's why it's important to present this information for a child before recess comes. And then he understands why situation is like that and how people are behaving and why they are doing these things. And nobody's even telling, like, no, you go for swing, no, you go for slide, no, you go for meeting your teacher and going back to class. I don't know if hopefully it makes sense to all of you. And my last part is about fundamental motor skills, like I mentioned, which is very linked to cognitive skills, social skills, and also sensory inputs, which might be experienced through fundamental motor skills. So we know that fundamental motor skills includes object control skills, which is part of every children's daily life, not only sport equipment, but also toys and different equipment they can find, books, and so on, and locomotor skills, jumping, running, and especially when going to playground. So there are a lot of experiences they can try their locomotor skills and to learn new skills as well. And also, of course, stability, which is very important to do any activity. You children have to have a good balance, and so we have to keep in mind that these children have delays in those fundamental motor skills, and they have also low muscle tone when they are young kids, and which also might affect their development. Yeah, so those skills they learn in early childhood also affect their later activities in their life, and there is very close association. Also, cognitive, as I mentioned, basically executive functioning, which is kind of over important decision-making process, and which helps us basically to organize our activities in a different environments. Yeah, I will, since time is getting shorter, I want to come to this video examples at the end of my presentation. So I just quickly remind you, because I have already mentioned this two types of assessment approaches, process-oriented versus product-oriented. So what are most important differences between process and product-oriented? So process-oriented, we basically look at how children do activities, what are separate stages of movement, while in a product-oriented, we look at how much, how fast, what is a product, how they do, what is the result of this movement. And there is a very good article if you want to learn more about those systematic review about fundamental motor skills and different instruments which have been used and outcomes. So I will also recall on this review a little bit. So in motor abilities, what is the difference? Just to remind you between movement and motor abilities. So motor abilities rely on neuromuscular capacities that contribute the performance on particular movement. For example, how fast, how much power you have to add to do a particular activity. While movement, it's a goal-directed movement, which is, for example, hopping on one leg performance and so on. And so what is the difference in children development? So we can see that in 6 months to 6 years, even here you can see in the 6 months, there is no really big difference between age-appropriate children and children with autism spectrum and language disorder, middle line. But you see when children are growing, their differences are increasing between, especially autism spectrum disorder, falling behind language disorder and, of course, typically developed children. So just give you some examples of product and process-oriented instruments. We mostly have used Brunsko-Zaretsky test, which is including 8 subtests with 53 items related to motor control, fine motor skills, movement skills, and balance, strength, running and speed, agility, and test of gross motor development, which I have presented in previous seminars as well. And there's also a third version. So what is the difference, for example, between able-bodied child and just switch off sound so I can talk for 2 more minutes. So you can see how child without any developmental delay is doing dribble, and you can see criteria for this process, and at the same time also product-oriented movement assessment instrument. And here you can see child with autism doing dribble, which takes more need to present, as you see, midline position. Also, there's challenge to understand how much force you have to give to ball to get it back in the midline, and how much eye and hand coordination you have to be aware of in order to control the ball. And yeah, so for these kids, we have to understand there are different ways how to support them. And in many cases, in the beginning, when teaching those fundamental motor skills, we use full physical assistance. And then in a way, we kind of use less and less support and use more visual, verbal supports. But in the beginning, like here, final slide, you see that there are a lot of physical input is provided to help children to do this movement correctly. For example, jumping to one side, and we have to model so they understand how and what to do this movement, and then demonstrate and let them to try themselves. Or for example, running. Here it's like running or jumping. Again, we do with modeling first, and repeat this modeling several times while they get information how to do this movement independently. Okay, so I think time is up, and I will stop here since our next presenter probably has joined. And I will follow your questions in the chat room if you have any questions. So please feel free to send me questions, and I will